In the name of God, hello and welcome. I'm Ali Razamadadi with the latest coming to you live from Tehran. The Iranian Health Ministry's spokesman says the number of people who have recovered from the novel coronavirus infection in Iran is about to hit 60,000 people, while the death toll has exceeded 5,200. In comments at a daily press conference on Monday, Kianush Jahanpur said COVID-19 has taken the lives of 91 patients over the past 24 hours, bringing the total death toll to 5,209.
Kianush Jahanpur also noted that 59,273 patients have been recovered from coronavirus infection so far and have been discharged from the hospitals. The spokesman added that the number of people tested positive for COVID-19 across the country has risen to 83,505 following the detection of 1,294 new cases since yesterday. He said among the coronavirus patients undergoing treatment in the hospital at present, 3,389 ones have critical health conditions because of more severe infection. The spokesperson also noted that more than 353,000 coronavirus diagnostic tests have been carried out in Iran so far. Meanwhile, the spokesperson for the Iranian administration said the novel coronavirus infection rate and the number of deaths from the disease are on a downward trend in Iran. Ali Rabi said at a press conference on Monday that Iran has seen a declining trend in the COVID-19 cases and the deaths due to the infection, pointing to a big rise in the domestic production of face masks and medical supplies after the outbreak of coronavirus. Rabi said the country has begun to export disinfectants. He further highlighted the administration's efforts to mitigate the direct and indirect effects of the coronavirus, such as unemployment and poverty, stressing that no other country in the world faces the cruel sanctions that Iran is facing. The spokesman also noted that more than 72 million Iranians have been screened for COVID-19, saying the second stage of screening include targeted tests. The new coronavirus is now running in the blood of 2,403,963 people across the world, and 165,227 others have died of the disease that it causes, according to data collected by Johns Hopkins University. Given that the outbreak has been weighing heavily on the global economy and the heavy costs of the massive economic freeze, some countries have been pondering a cautious easing of the lockdown measures enforced to curtail the disease. After a virtual meeting on Sunday, health ministers from the group of 20 major economies in a statement admitted to systemic weaknesses in health systems in the face of the pandemic. They said the outbreak had shed light on the vulnerabilities in the global community's ability to prevent and respond to pandemic threats. They said that they had adopted preventive measures to contain the pandemic, but did not elaborate. According to an earlier G20 statement, leaders from Spain, Singapore, Jordan, Switzerland had been invited to attend the Sunday meeting. So were representatives from international and regional organizations, including the World Health Organization WHO and the World Bank. The U.S. death toll from the novel coronavirus rose to more than 40,000 on Sunday, the highest in the world, and almost double the number of deaths in the next highest country, Italy, according to a Reuters tally. It took the United States 38 days after recording its first fatality on February 29th to reach 10,000 deaths on April 6, but only 5 more days to reach 20,000 dead, according to a Reuters tally. The United States toll increased to 40,000 from 30,000 in 4 days after including untested but probable COVID-19 deaths reported by New York City. The United States has by far the world's largest number of confirmed coronavirus cases, with more than 750 infections, a number that has doubled in 13 days. New cases on Saturday rose by nearly nearly 29,000, the lowest increase in 3 days. Now, more than 22 million Americans have filed for unemployment benefits in the past month, as closure of businesses and schools and severe travel restrictions have hammered the economy. Governors in the U.S. states hardest hit by the coronavirus sparred with President Donald Trump over the claims they had enough tests and should quickly reopen their economies as more protests are planned over the extension of stay-at-home orders.
Moving on, the spokesman for Yemen's Ansarullah movement says the current United Nations proposal on a ceasefire neglects a key demand to lift Saudi Arabia's air and sea blockade, which fuels the country's humanitarian crisis. He also refused short-term solutions, saying the blockade must be removed before any serious talks.
The UN Security Council on Friday endorsed Secretary General's call for the warring parties in Yemen to immediately stop fighting and focus on reaching a peace agreement and countering the outbreak of the new coronavirus. The Council's statement followed a briefing Thursday by UN Special Envoy for Yemen Martin Griffiths, who said the threat of COVID-19, the illness caused by the new coronavirus, has galvanized peace efforts. Griffiths said talks with the warring sides are making very good progress and that he expects them to adopt proposals for a nationwide ceasefire and peace talks in the immediate future. But Mohammed Abdel Salam, a spokesman for Ansarullah, said Thursday the current UN proposal neglects a key demand to lift Saudi Arabia's air and sea blockade, which fuels the country's humanitarian crisis. He also refused short-term solutions, saying the blockade must be removed before any serious talks. However, political parties believe the party which must end the war is Yemen because their country is destroyed by the enemies.
The UN itself has given green light to the coalition to unleash its brutal war on our country by turning a blind eye on atrocities against Yemenis. Those who initiated the deadly war can eventually end it, but it should be Yemenis who end the war after they achieve their goals. The enemies have destroyed Yemen's infrastructure and killed the country's innocent people.
This comes as Saudi Arabia and its allies are accused of violating the ceasefire despite Riyadh's unilateral declared truce of 2 weeks. Yemen's armed forces spokesman Yahya Sarri'a says Riyadh has carried out tens of air raids since it announced ceasefire. He warned that more painful attacks would be carried out in response to such escalation.
Since the declaration of the claimed troops, the coalition has carried out many attacks and battlefronts, while the United Nations is keeping silent. They are violating the Sweden peace accord despite the positive steps taken by the army and Ansarullah fighters to salvage the only solution.
Many rounds of talks have failed to bring peace to the war-torn country. Talks had been described as the first breakthrough by the UN. Yet such diplomatic efforts have failed to bring an end to Saudi aggression against Yemen that has killed and injured thousands of civilians. The arrival of coronavirus, which reported its first case earlier this month, threatens deeper and more widespread suffering in the Arab world's poorest country. Many stress the importance of access to humanitarian and economic aid for Yemenis in need, which is especially important in light of COVID-19 pandemic. Mohammed Attab, Press TV, Sana'a.
Now, Iranian Foreign Minister Mohammad Javad Zarif has met with Syria's President Bashar al-Assad as well as his Syrian counterpart Walid al-Muallem during a visit to Damascus. Zarif, who was in the Syrian capital at the head of a political delegation for a one-day visit, held the meetings on Monday. During the meeting with the Syrian president, Bashar al-Assad said the ongoing global crisis caused by the novel coronavirus pandemic has exposed Western countries' failure and immorality. The Syrian president also offered his condolences to the Iranian government and people over the loss of lives caused by the deadly coronavirus. He lashed out at certain Western countries, mainly the United States, for using the pandemic as a political opportunity to impose sanctions on other states despite the current exceptional humanitarian circumstances. The Iranian foreign minister, for his part, said the U.S. administration's refusal to lift sanctions on Syria and Iran has revealed its inhumane nature to the world. Elsewhere in their meetings, Zarif and Assad discussed ways to develop bilateral relations, particularly in the economic sector, and the implementation of joint ventures to serve the interests of the two countries' people. They also exchanged views about the latest political developments, including the Astana process and the persistence of Turkish military aggression in Syria's embattled northwestern region. And finally, Caracas has slammed Washington for seizure of Venezuela's money in U.S. banks.
Following instructions by President Donald Trump, the U.S. government has ordered the transfer of some $342 million in funds from a Venezuelan central bank account at U.S.-based Citibank to an account controlled by opposition leader and self-proclaimed Venezuela's interim president, Juan Guaidó. The opposition leader, who is politically backed by Washington, holds a bank account at the New York branch of the U.S. Federal Reserve, in which huge Venezuelan assets confiscated by Washington have been deposited on Guaidó's behalf. Meanwhile, Venezuelan Foreign Minister Jorge Arreaza decried the Trump administration over its move to strip Venezuela of its money and redirect it to Guaidó without any legal basis to do so. The top Venezuelan diplomat claimed that the alliance between the Trump administration and members of the opposition-led National Assembly has resulted in the seizure of millions of dollars in Venezuelan assets, this time part of the savings of the country's central bank. Arreaza says the U.S. move is outrageous and criminal, as it comes at a time when most countries are seeking financial resources amid the economic fallout from the coronavirus pandemic.
Again, this nation is targeted by the U.S. economic aggression. Caracas will respond with legal action.
Meanwhile, the opposition justifies the U.S. move.
The U.S. has taken away money from the corrupt Maduro regime. I will make sure that the money will now be distributed accordingly.
However, medical experts regret the spat, saying financial resources should be immediately available for the fight against the COVID-19 outbreak.
Many more medicines must be bought to contain the virus outbreak, but if the government don't have money, things may get worse.
From this perspective, officials say funds will be provided despite the U.S. sanctions.
Although the U.S. continues to steal our country's assets, Caracas will find ways to fund the fight against COVID-19 anyway.
The U.S. has repeatedly confiscated Venezuela's assets and funds and given them to the so-called interim president, Juan Guaidó. Caracas describes these U.S. actions as blatant robbery. Jesus Silva, Press TV, Caracas.
Thank you for staying with us. Good night.